The field of cancer immunotherapy has really developed into something which became a standard of care treatment for many tumor types. And what we have learned that there is in many patients a spontaneous anti-tumor response that can be unleashed when we remove some of the brakes by targeting immune checkpoint receptor on T cells that basically block their activity. However, this works only in a small percentage of patients across different malignancies. And here it's where radiation comes into the play with what is really a new role for radiation therapy. It has been used for a very long time to control locally the tumor. But in a setting of cancer immunotherapy, what we found is that actually radiation can be used to convert the irradiated tumor into an in situ vaccine, basically a site where T cells can actually become primed, activated against tumor antigens, and then they can migrate to other places in the body. In a setting of metastatic disease, they can actually mediate what is known as a abscopal effect, meaning regression of tumors outside of the radiated field. Now, this does not really happen with radiation alone, but it does happen in combination with immune checkpoint blockade, because you now are providing what is missing in some patients, basically activation of T cells, and then you remove the inhibitory pathway that block this T cell from being capable of attacking the tumor. So that sounds simple, but of course we have been studying this for almost 20 years now, I should say, before the checkpoint actually entered the clinic, based on our observation actually that you would take a mouse model that does not respond to CTLA-4 blockade. Is the first checkpoint that was actually approved for clinical use. And if you irradiate the primary tumor, now the mice not only respond locally, but they also control systemic metastasis. So what are the key signals? Radiation does a lot of things, and it does have inflammatory, it produces inflammatory signals in the tumor. But what we found that a key pathway that needs to be activated to really prime T cell responses is activation of Taiwan interferon. And we found actually that this really is a process of viral mimicry. Basically, the damage caused to the DNA by radiation leads to translocation of some of the DNA to the cytosol of the cells, where it can be sensed by sensors such as CGAS that are there to really they are usually activated by viruses that enter the cells. And this activation is then triggering signals that result into production of Taiwan interferon, a major cytokine whose role was really well known in viral infections, but is capable of activating actually the response, the T cell response, particularly the cytotoxic T cell that are really important for controlling viral infections. They are also important for controlling tumor. And so when radiation is used in the sort of way that it can trigger this pathway, it really makes the immune system think that the tumor actually became a sort of an infected site. And that's why we think it really works well at priming new T cell responses.